Hi guys, welcome back to my channel. Guys, there is a lot of heat waves now. In this heat waves, in this hot weather, there is a lot of hypertensive patient, especially in the North Indians and all over South India and all over India. And in fact, in the foreign countries also, there are a lot of temperature issues. There is a rise in temperature. What we are using to control the high BP is that first of all, what we do is we take Brahman leaves. It's the smallest quality breed of the Brahma leaves. So what we do is take few leaves of it, and then we put it here, and then we make paste out of it. And that's, you can see that it's a green color leaves. So it is being pasted. And now what we will do is, that is how we put it. And this is the juice, green juice of uh, breed of a breed of Brahma leaves. So this is mainly used for urinary tract infection, and in cases of bacterial infection. And if you have that is how it is used for urinary tract infection. And mix it with water if for urinary tract infection, bacterial infection. And in cases of lactation, you can use this Brahma leaves, small variety of Brahma leaves. And it is good for health, and additional benefits like it will remove and detoxify your body. Not only this much amount of water, but you have to add more water in it. Is just to show you how to make it. You have to make a thick paste out of it. Make a lot of there are other varieties of Brahma leaves are like Thankuni, that is found in West Bengal region and also marketed in Flipkart, and in the name of Cestella. So you can see that there also Thankuni and Brahma, and this is the smallest quality of the Brahma found in this place, Ganganagar, Rajasthan. So actually that's the best breed. Right now I'm having it, but you can also use Thankuni, like Cestella, and also can use Brahma leaves for this purpose. So guys, the next thing that you need to have is, in this weather, is to drink lot of coconut water. Like need to have coconut water, because in this hot weather, in the summer weather, we need lot of coconut, because it makes you feel cool from inside, and also relieves the hypertension. So those who are suffering from high blood pressure, especially the workers who are working for the construction businesses and making buildings, and the people who are really hard workers, and students, even the all are all in this weather, like in the hot. So in India and over the guys, you need to have a lot of coconut water in this hot and summer weather. And this is very much important to drink for especially the hypertensive patient, and for the people who are dealing with hypertension and are hypertensive. And guys, the blood pressure in this hot weather and summery weather, it's very much common, especially in India. It's very common, and in foreign countries also it's very common. So you need to have the coconut water always, so to make your skin rejuvenating and feel hydrated. And you should have guys, the next thing you need to have guys, the next thing you need to have is Mosambi juice. So Mosambi is it's a sweet lime, so it should be used. And you make a juice on water in this weather, hot weather, you need a Mosambik juice, or you can make an orange juice for maintaining the blood pressure, because it's too hot outside, and you travel to long distance in this hot weather, so you need to have this Mosambik juice, and an orange juice. So it will keep yourself hydrated, and electrolytes of the body will also be maintained in the body. And also glucose you should have, if you don't have any sugar problem and all. So yeah, you can have glucose, and you will get instant energy and relax, guys. That's the thing. So the next third thing that you need to have is this is Tata salt, iodized salt. So this is the new recently launched product, Tata salt light. It's new to the market. It's not a very old selling product, but it's a Tata salt light sodium curtal iodized salt. 15% is sodium production and active health management. So this is like one of the best blessing that Tata has launched their salt, and Tata salt. This is the Tata Salt Light. So this is such a big blessing for the hypertensive patient, and also the patient who are suffering from thyroid. So this is one of the best salt, because sodium content of this is less, whereas in other harsh the sodium content is very high. So it lead to thyroid problems. So this is this is less sodium content. So the Tata salt light, so it doesn't cause any thyroid, it does not trigger any thyroid rich hormones. And yeah, Tata salt light is one of the such a blessing for the hypertensive patient. So what you have to do, if you are hypertensive and doctors refer you Tata salt light, then mix a pinch of Tata salt light with water and drink it. So guys, you can drink lots of water for hypertensive patient who is having high blood pressure. Guys, what you have to do is you have to drink lots of water, um, for BP patient and for the blood pressure, especially this. So guys, what you have to do is you have to drink lots of water for hypertensive patient, for the blood pressure. So you have to maintain the BP in this hot weather, and it's very dry in this weather. So it's very important to drink water for the workers and even the health workers, and even all the people who are going to schools, colleges, and who are um, running outside for leaving. So yeah, they need to drink a lot of water. And yeah, anti-hypertensive drugs like diuretic furosemide, you can have it, but after having water, okay. Then orange juice and Tata salt, sugar, and taking some rest. Then if you feel that you are hypertensive, sometimes hypertensive is more than a level. So it is very important that to maintain the BP. Normal is 120 by 80 mmHg, but normally what happens, that sometimes for the old patient or older people, the BP increases very much, and gradually with age the BP increases very much. So what you have to do is, after having all the drinks and whatever I have said, you should take antihypertensive medicine if not cured. So furosemide, you can have it. So it is one of the safest drug, but you should also talk to the doctor.